Zikalala is giving us an update with regards to the coronavirus situation there. Currently, the numbers that we have in front of us is 60,355. That's the active cases in KwaZulu-Natal. 60,355. Let's take you there now live.
Media, compatriots, ladies and gentlemen, we wish to extend a warm welcome to you as members of the Fourth Estate as we host this first media update of the new year 2021. In the same breath, we take this opportunity to wish you and all South Africans a new year that is filled with good health, happiness, and personal fulfillment. We know that at this time, wishing you Happy New Year for many people is called comfort, for they are already in mourning, having lost their loved ones due to COVID-19 or other causes. Indeed, many people have had to bury their parents, grandparents, friends, and neighbors due to this virus. Some are waiting to bury, others are themselves sick in hospital or may need to be hospitalized. Many who have not lost their loved ones already have a bleak outlook for what lies ahead. They are highly anxious because of the high rate of COVID-19 infections and deaths around them. As the strong second wave of this deadly virus continues to take its toll, things are indeed tough, and it feels like life as we have never known it before. But this is not a time to be despair or to lose hope. It was Albert Einstein who once observed that in the middle of difficulties lies opportunity. Now is not a time for us to be consumed by despair. Rather, it is a time for us to work even harder than ever before and contain the spread of COVID-19. We have an opportunity to fight and turn back the tide of COVID-19 by taking actions to protect ourselves and our loved ones, by following the precautions and seeking help immediately if we get sick or see symptoms. We need to act responsible and not to just pay lip service when it comes to taking precautionary measures. We need to realize that every decision we take and everything we do has an impact on our lives and our ability to curb the spread of the virus. We also wish to take this opportunity to salute and thank all the responsible citizens of KwaZulu-Natal for their relatively good behavior during the festive season. As a result of your adherence to the restrictions under alert lockdown level 3 on New Year's Eve and on New Year's Day, some of our busiest hospitals in the province reported a very low intake of patients. Their emergency and trauma units were virtually empty, thanks to the early cafe and the ban on alcohol sale. This includes hospitals such as Prince Mshieni Memorial, King Edward, Eddington, Edendale, Matadeni, Ngwelezane, Potchefstroom, but of course others in the province. This means that nurses and clinicians could invest their scarce resources where they are needed most, not on treating people with injuries from avoidable alcoholic-related incidents that happen late at night. Relating on this unusual situation, one of Emergency Medical Service Directors said, as I quote, "Since I joined EMS more than 30 years ago, it's my first New Year's Eve where before midnight my phone was quiet, without any motor vehicle accident reports, let alone after midnight. KZN, EMS, private ambulances and law enforcement have reported no accident Clearly, we can learn a lot from this about the effect of alcohol, close quote. And this statement does not come from us as government, and I'm underlining it. It doesn't come from us as government, but it comes from one of those who are directly involved and working throughout his 30-year service. He's narrating that it's for a first year to have such an experience. So to the people of KwaZulu-Natal, we say congratulations and keep up the good conduct you have displayed. A warning to those who are involved in illicit liquor trade. Since the announcement of the Level 3 lockdown, we've activated all role players within the provincial joint operational and crime intelligence structures to ensure that there is a compliance in terms of the Disaster Management Act. While security forces have observed that the majority of citizens are complying with the regulations of the Disaster Management Act, there are still pockets of people across the province that are still non-compliant. As of 29 December 2020 until the 1st of January 2021, 729 people have been arrested for non-compliance of COVID-19 regulations across KwaZulu-Natal. At least 246 of these persons were arrested for failing to confine themselves to their residence during the cafe hours. No fewer than 66 people have been arrested for transporting, selling or consuming alcohol in a public space, while 392 were arrested for not wearing their mask in various public spaces. Furthermore, many others have been arrested for other contravention of the disaster management regulation. The message from the security forces and from the government at large is clear. There will be no mercy for those who continue to flout the disaster management regulation and thereby putting other citizens at risk. Police officers will continue to conduct operations in hotspots areas across the province and will hold roadblocks and stop and search, as well as other operations to ensure that citizens comply with the disaster management regulations. We also want to issue a serious warning to both established liquor outlets as well as individuals who are selling liquor illegally. Those and the so-called take it or leave it merchants, that we will come for them and we are here to deal with their behavior, because they are enemies of our progress. We want to send a message, kuze kungabi nokukhala nokugedla kwamazinyo, when we confiscate your stock, revoke licenses, and arrest people, because that will have to happen to all of those who undermine the regulations. We have no tolerance for these unscrupulous enemies of people's good conduct. We call on all right-thinking South Africans to not only isolate these people by supporting their trade, but to also report them anonymously to our contact number, the SAPS number, which is 10-111. We must understand that our nation as a whole is in mourning. Given the unprecedented high rate of infection and mortality due to COVID-19, we really should consider ourselves as people who are in mourning. Singabantu abazilile. When you are in mourning, there are certain things or privileges that you simply have to stop or even ignore and not do at all. So let us continue to respect the restrictions that government has imposed. And these are not imposed on us, but these are restrictions that are imposed to ensure that we are all protected. And at this point, we want to emphasize this. By wearing a mask, by social distancing, by washing your hands, you are not doing this in favor of government. You are not doing government a favor. it is about protecting yourself and protecting your loved ones. And let us engage in practices that have been scientifically found and proven to prevent the spread of the virus, such as wearing our mask where we go out, wash our hands with water and soap, or sanitize. We are extremely concerned that we have started the new year on a bad note, having breached the 5,000 mark for daily COVID-19 infections. 3 days ago, when we were reporting the stats for the 30th of December 2020, our province had recorded 5,846 new infections and 116 deaths. It was the first time that we had gone beyond the 5,000 mark, let alone approaching 6,000. The next day, on the New Year's Eve, we improved slightly in terms of infections and registered 5,311 new infections. But we registered 134 deaths, which tells you that even when numbers on infections slightly decreased on that day, deaths were still high. On New Year's Day, on the 1st, we again saw a slight improvement where we recorded 4,974 new infections and 21 fatalities. As of yesterday, we recorded a total of 4,714 new infections, bringing the province's total number of COVID-19 infections to 209,691. Sadly, 85 people lost their life over the past 24 hours. Again, may their precious souls rest in peace. We equally send our deepest condolences to the bereaved families. In terms of distribution of cases and deaths by district, we will provide that information, but in summary, in eThekwini, we have a total number of 109,144 new cases, 14 new deaths. It's not new cases, it's a total number of cases, 109,144. Then the deaths stand at 2,308. In Ilembe, we have 13,468 total number of cases, and the deaths are 175. Umkungundlovu, 22,841, and 641 people have passed on. In Uthukela, 7,140 total number of cases, and the total number of deaths are 197. King Cetshwayo, 15,380, the total number of cases, and the deaths are 361. Ugu, the total number of cases is 11,690, and the deaths are 207. Amajuba, the total number of cases is 7,871, and the deaths stand at 262. When it comes to Umkhanyakude, 4,960 is the total number of cases, and the deaths are 114. Hirikwala, the numbers of infections are 5,523. The deaths are 185. Zululand is 6,141. Deaths is 92. Umzinyati, 3,551, and the deaths are 100. They are unallocated in terms of the cases, 1,982, it's unallocated. So this is a breakdown of the spread throughout KwaZulu-Natal. When it comes to emerging trends, the province has observed that the six districts that have been declared hotspots, which are eThekwini, uMgungundlovu, Ugu, Hirikwala, King Cetshwayo, and Ilembe, are recording a high number of cases daily. Family clusters have also increased, which clearly indicate that infected family members are not complying with self-quarantine and self-isolation rules. There are also a number of home deaths and people dying on arrival at health facilities, which is a clear indication that people are reporting late to healthcare facilities. We have also noticed that there is an increase in the number of index cases who are refusing to give a list of their contact. This is highly problematic as it hampers contact and tracing, which is the cornerstone of the public health response to COVID-19. We are also concerned that some contacts are refusing to be tested. In terms of capacity to respond to this pandemic, we can say that our approach to the second wave as the province, we have prepared more beds in response to the demand. Our response includes the following: repurposing of 540 beds in eThekwini, Ilembe, and Hirikwala. Commissioning of field hospitals, which will give the province an additional 954 beds. The province has also engaged private facilities, which are hotels and lodges, for extra beds, and so far 2 facilities have been commissioned at Ugu and King Cetshwayo district. We must also say that we want us to partner as the society in the fight against COVID-19. And since the confirmation of the first case, which was here in the province in March 2020, as government, we moved swiftly to create bed capacity, as well as we made available human and material resources so that we combat the spread of this virus. We have helped a countless number of people with getting screened, tested, and admitted for isolation or quarantine, which has contributed positively to the number of people who have recovered from COVID-19. Our hard-working and valued field agents, nurses, and other dedicated staff continues to do this on a daily basis. We want to remind our fellow compatriots and citizens of the province that if you suspect that you might have symptoms for COVID-19, the first thing to do is to keep yourself away from other people so that you will not infect them. Continue to wear your mask. You then need to contact your nearest health facility so that arrangement may be made for you to get screened and tested. In some instances, a team of field agents may come to your home and test you. People who test positive need to inform their nearest healthcare facility so that they can be sent into isolation. We are now at an advanced stage of re-establishing our contract with private sector facilities which accommodate people who cannot isolate themselves at home. We plead with communities to protect and look after our field agents when they come to test people at their home. You must remember that you or your loved ones could need their services in the near future. We are also encouraging people to download the app, the COVID-19 app alert, so that they may find out if their friends or those that they've come in contact with have tested positive or not. This app will not reveal any name, but it indicates where you stand as a person as far as the exposure to COVID-19 is concerned. With regard to healthcare workers, a total number of 8,723 healthcare workers have now been infected with COVID-19 in public sector since the beginning of the pandemic. Of the total infected, 98, which is 1%, have sadly succumbed to the disease. The majority of the infected healthcare workers are nurses, and that is 56%. In terms of admissions in hospital, as of the 2nd January 2020, the province had 4,340 patients admitted in both private and public hospitals. Those who were in private hospitals were 2,474, and those who were in public hospitals were 1,866. Of those admitted, 472 patients, which is 11%, required intensive care services. Private hospitals have more patients in ICU. Among those who are requiring intensive care, 139 were ventilated in both private and public hospitals. Of the total available COVID-19 dedicated isolation beds, 1,925 were vacant. 1,925 were vacant. Of the total ICU beds, 127 allocated in public sector were occupied, meaning that we have a 50% capacity in the ICU. And this tells you that the fake news that have been spreading around are far-fetched and just serve to mislead the people. We want to send a strong message that we have noted a number of conspiracy theories, particularly on the social media, from people claiming that COVID-19 does not exist and that it is somehow related to 5G mobile communication technology. And others have sought to cast aspersions on the vaccine for COVID-19 and have discouraged people from taking the vaccine when it becomes available. We are pleading with those people to stop spreading fake news and malicious misinformation. At a time when we are grappling with this virus and doing our best to make the vaccine available to our people as quickly as possible, we can ill afford to be detracted by the work of people who clearly have too much time on their hands and their side. We plead with the people and these people to stop misleading the nation. Rather, invest your time in researching the real origin of the virus from reputable academic sources, and also try to gain a better understanding for yourself rather than spread academic sources, and also try to gain a better understanding for yourself rather than spreading lies. We once again call upon each and every citizen of this province to help us beat the pandemic and save life. We all need to realize that we are in a difficult time and behave like people who are in mourning, as we indicated earlier. That's what the new normal is all about. Young people in particular have been found to be among the biggest contributors to the movement and the spread of COVID-19. This is largely because the vast majority of them tend to be outgoing, but also because they tend to contract the virus and not show symptoms. But when this happens, they are still infectious, and they easily pass it on to the older people, including their parents and grandparents. And then, as a result, some of the people become sick and others end up passing on. This is why it is important for the youth and all of us to adhere to the precautions and avoid large crowds. Again, let us please use the only tools that have been given to us to combat the spread of the virus, and that is wear our face mask when going out, wash our hands regularly with soap and water, or use alcohol-based hand sanitizer, and also maintain social distancing. Once again, our thoughts and prayers are with those who are grieving at this time. May your tears be wiped away, and may you find the strength and fortitude to carry on with your lives despite your loss. To the rest of us, would once again let me close off these remarks by quoting and borrowing from the words of the Director General of the World Health Organization, Dr. Tedros, who said recently, and I quote, "We are asking everyone to treat the decisions about where they go, what they do, who they meet as life and death decisions, because that is what they are. It may not be your life, but your choices could be the difference between life and death for someone you love or for a completely stranger," close quote. It is in our hands, all of us who have a role to play. I thank you.
Thank you very much, Premier. The Honourable Premier has given us a very clear and detailed, informative statement. There may be colleagues in the media who are joining us from outside and from within this room who may have questions of clarity. We're going to take those now. And we have the Premier and the MEC who are going to respond as direct. So we are going to then start with the questions, or we'll start here. We'll maybe take a quick round here and then respond to the other questions that are coming in from outside and more. So let's start inside then with Babu Mjali. Can I just ask us to introduce ourselves quickly when we ask the question? So we'll start with Babu Fraser Mjali there, and please ask the question.
Fraser Mjali. Am I audible? Fraser Mjali from Phumelela newspaper. I just want to know how accurate are these figures that were given. The reason I'm asking this is because some people are said to be dying out of health institutions. They leave home, they go somewhere, they come back, they are dead. And from there they go straight to the mortuary. So I just want to find out how accurate are these figures. That's number one, but I'll ask a question later, another one. Thanks.
Can I just do this side and then come to my left? Can I go for you, Baba? I can't see you. Can you introduce and then ask the question?
Bongani Gema from SABC. The report that our province now has the status of the highest number of positive cases nationally. I'd like to know why is this the case? Is maybe the number of visitors that came to our province, or is there other factors at play here? Thank you.
Okay, that's clear. That's clear enough. There's a daily news.
Yes,
Ma'am, can you just introduce yourself quickly and then ask the question? Thank you.
Noma-gugu Simelane from the daily news. My first two questions are for the Premier. The statistics that you shared with us about illegal liquor trading, people who were arrested for breaking the curfew. Where did you get them from? Are those from SABC, police, other law enforcement agencies? I just want clarity on that. And queues at the post office can be perceived as a super spreader. People are always on top of each other, it's crowded, and there's a lack of social distancing. Does the province plan on doing something about that? And then my third question is for the MEC. MEC, following your webinar the other day, the chairperson of the South African Medical Association said that claims about getting enough beds were misleading. Patients are also on stretchers, benches, and wheelchairs to be admitted. Moreover, there was a dire shortage of medical staff, who are overworked and on the verge of burnout. Oxygen and PPEs are also an issue. PPEs apparently are substandard and they break when they are used and don't offer the correct level of protection. From my side, one hospital in particular is in KwaZulu-Natal, where there is not enough PPEs. For example, CN95 masks, they only have a small. And when doctors and nurses put these on, they might require them to use more than they use. This also goes for the PPE, like the whole jumpsuit thing, etc. Yeah, that's it. So I would like the NEC to respond to my statements that were sent by Dr. Katsina and the PPE issue in Africa and in general. Thank you.
I'm not sure if the Premier and the MEC noted those questions. Okay, sure. Are there any further questions? Yes.
Thank you. It's Bongani Gema from News of Africa. Premier, in terms of going forward, I know you said that regulations are working, people are complying, and that the regulations have been followed, but there are businesses who have been complaining that, since it was closed on the 16th, beaches, everything, they lost out and they don't think they'll reopen again. Is the province investigating, maybe alleviating some of that pressure on those businesses who say that they've lost so much that they don't know that they can recover after the new lockdown regulations are lifted, if they will be on the 15th? And for you, MEC, last time you had a webinar, you also spoke about the fact that beds are enough right now, capacity is coming through, you're satisfied with how things are going, but with the new infections rising, the fact that they're not being breached, is that still the case, or are you investigating more ways of how capacity can be increased? And number two, when it comes to trauma beds being available because alcohol sales are closed and bars and taverns, is there a way of capitalizing that so that in the future you don't really have to depend on alcohol being sold? Because short of banning alcohol forever, what's the other plan there? Thank you.
I think, colleagues, can I just then ask the MEC and the Premier from outside? Yes, so there's a couple of questions from the social media and from already that preparations for the second are sufficient. Those are the questions so far. I think we're going to take one round unless there's any other burning issue. Thank you very much.
No, thanks. I will answer questions that do not relate to the health and leave those that relate to the health department to the NEC. But I will want to comment on one, the high number of infections. I think it will be incorrect of us if we would want to apportion that to the visitors. Because those who come from outside, once they are here, whether they are tourists or what, they are in KwaZulu-Natal. We always want them when we want to grow the market. So we want to grow the economy. You invite people. When they are here, you begin to say, no, it's you who are a problem. We will not take that approach. The second issue, Tobeka, the source of the data. We have a joint command where all law enforcement agencies are operating, reporting on daily basis. The officers from what you will call municipalities will escalate numbers to the district. And in districts, that's where each district compiled the data. It is then sent provincially. So when we talk about the province, we talk about the whole. Our operation is having footprint in each and every locality in the province. The issue of the post office, we will try to attend to it. As you raise it, we have also received reports from our own operational centers that this matter is beginning to be a problem and we need to attend to it. We will be raising it with the National Command Council and the National Minister. I think those were key. The last one is about the businesses that have closed. We are working on launching a comprehensive economic recovery plan at the end of January or beginning of February. That follows the unveiling of the recovery plan by the President. But we have to say, what is then the structure of the economy in KwaZulu-Natal? And linked with what the President has presented, what is it that we believe that we should do to stimulate growth of the economy? We know that the lockdown imposed harsh operational methods, and others were forced to close. But there was no decision that said, close this industry and this industry. We just regulated, especially industries that are selling alcohol. Now, I think without apportioning the responsibility to the industry, but it is a collective task that we as government and the industry will have to go through to ensure that there is no business that closes and that the economy is recovering. We have said that with regard to tourism, we foresee that it might take us to 2022 for the industry to come back and be vibrant as it was before. So we will work with them, though we will not want to take and say those who want to close, because others would just want to close because they were not doing sufficient profit. And that's the nature of business. In a capitalist world, once the industry begins not to accumulate wealth, the first is to retrench, the second is to close without looking on other options. Reinvestment and all of that comes late. So we would want a situation as social partners to come together and work together to ensure that no industry is closed. I think I've covered your question. Thank you.
Good afternoon, ladies and gentlemen. Good afternoon to the Premier. We have a few questions. Let me firstly respond to Ubaba Mtshali on the question on how accurate are our numbers. Baba Mtshali, our numbers when it comes to deaths are accurate in a sense that when we report on a daily basis that today we have, as we Premier reported that today we had, I think, 45 deaths. It's not deaths that happened today or happened last night, therefore reported today. What we normally do is that over the week, we put together a statistics of all the deaths that have happened, deaths that happened in our facilities, but we also bring on board home deaths as well. So our home deaths are often reported on a daily basis, but that not clearly, well, not saying that they happened the previous day. And let me give you an example. Someone would passed on at home about, say, on Thursday, and we only get that report because there are a number of things that need to be followed. We get the report on Monday. That death will be reported on Tuesday as a death reported that day, but not meaning it had happened on that day. People who passed away at home, when they are suspected of having passed on because of COVID-19 related complications, they are then tested even though they have passed on. So we believe that in the process we are able to catch everyone who passes away. The Department of Health has an arrangement and a discussion with funeral parlors, especially those that will also go and pick up people who have passed on from home, so that before they follow them, they do whatever that as funeral parlors they need to do. They have to report to the Department of Health these are the people that they have picked up, or these are the people who have passed on, therefore these need to be swapped, and we go in as a department and swap them. So we believe that the numbers that we have are quite accurate. They might not be accurate for that day, but it's a cumulative number that actually gives us a proper sense of what has happened. Sometimes we also find that someone would pass away in eThekwini, but they don't really leave eThekwini. It just so happened that that's where they fell sick. And within the 3 or 4 days of putting together the data, we as a Department of Health have to then take that death and allocate it correctly in a district where that person came from. Probably they were coming from Zululand or Mkanyagute, and they were visiting and they happened to fall sick while they were in eThekwini. Therefore, we then move that death and put it in the correct district. So you find that over the week there is quite a number of maneuvering of numbers, because we are updating, because we are getting those that have passed on from who did not pass away from the hospitals, plus those who were not correctly allocated in terms of districts. So our numbers might not be accurate in a sense. When we say 45 people died, when we say 45 people had passed on today, we are not literally meaning they passed on yesterday. It's because yesterday those were the people that were reported. So in that sense, we think that they are accurate. Of course, there probably might be some that fall within the cracks, and that is where we request that we have proper partnerships with our community, with the society, and the funeral parlors, because without them we might not be able to catch those that actually pass on at home. The province has the highest number. That is the question asked by Bongani. I don't think that's accurate, Bongani, so far. Although we are worried about the numbers that are going up, we are number 3 in terms of the cumulative numbers as the province of KwaZulu-Natal. The highest number or the highest cases are in Gauteng. They have 291,000, followed by Western Cape, 209,000, and we are number 3 with 204. Of course, we were number 4 a couple of weeks back, and with the huge numbers that the Premier was talking to now, reading, we have then now become number 3. So at this point, that is where we are. Of course, we are not happy about that. That is why we keep on saying and insisting that our people must adhere to protocols, because it is the only way of stopping the infections where they stand. So yes, Premier responded to whether the high numbers are as a result of the visitors that we have in the province. Scientifically, we can't prove that, because it's people who have tested in the province of KwaZulu-Natal, and we don't think it's going to assist us to split hairs in that particular fashion. All we need to do is to ensure that we are able to treat our people as they should be treated. Utobega was asking about the issue of beds and PPEs, and I think there's quite a few questions that are relating to beds. Let me speak to what you have, the quotation that you've just read from Dr. Kutsie. Unless Dr. Kutsie works in one of our facilities and gives us an actual example of which facility does not have beds, I don't think it's accurate for people to make general statements like those. It's exactly what I was calling for last week when I say, can we not create a crisis where a crisis does not exist as yet? Premier was reading the numbers, and the numbers that he was reading are very accurate numbers. On a daily basis, as a Department of Health, we make sure that we get the statistics on the availability of beds, on the availability of general beds firstly, on the availability of COVID beds, because we've got COVID dedicated beds, but we also have COVID dedicated ICU beds. And at any given time, we know which facility has what bed. Yes, it happens that some facilities will run out of beds because of the number of patients that they see, and if that particular facility runs out of beds, we immediately kick in our plan and we move patients to the next facility. You take Umgungundlovu, for instance, as a district. This is the reason why we have created a field hospital in Royal Showgrounds, because we want to make sure that all the facilities that are in Umgungundlovu are not inundated and to have too many patients and don't know what to do with the patients. So if Northdale, Edendale, Grays, even Richmond run out of beds, we know that we then have a proper referral system on how we refer those patients to the Royal Showgrounds. Royal Showgrounds as a field hospital has more than 250 beds. And as we speak now, we've not utilized even 5% of those beds. So there is no way we can say we have run out of beds in the province. We come to eThekwini as a district. In eThekwini, we have close to 19 hospitals, and in these 19 hospitals, yes, from time to time, in areas where the catchment, the facility caters for a bigger catchment, sometimes we run out of beds. But when we run out of beds, in that particular minute, the hospital manager or the clinical manager is able to get in touch with the district director, and we are able to move patients within the district. When you look at eThekwini, we have created capacity in a lot of hospitals. We've created more beds in hospitals where it didn't have those beds before. We have created a field hospital in Clearwood that has more than 228 beds. And of those 228 beds, currently we are only utilizing 50%. And this is a fact. It's not something that I'm not being general. When you go to Clearwood Hospital, and I'm talking about the field hospital in Clearwood, you'll find that right now we have about 113 patients, and we've got another 112 or so beds that are still available. So it's not correct that we don't have a bed capacity, and I think we should frown upon people who make such general statements, because they create a panic amongst our people, and as a result, people don't go to our facilities and they die at home when they don't have to die at home. So we are making a call that our people should make their way to our facilities. We have enough beds. Should there be not a bed available in that facility where you are in, we already have a plan. Our plan kicks in. Our EMS moves patients from one facility to the next. We even have a plan that says, should we run out of beds in a district, we will move those patients to a different district that is closer to them. It has not happened yet. It has not reached that point. We are very far from that point right now. But it is our plan, so that if we run out of beds, then we do have a plan. Because the reason why we have that plan is that when you look at our districts, you find that it is almost the city centers that are inundated that has bigger numbers more than the rural districts. eThekwini, Ugu, Herikwala, have the biggest number of patients. So if we run out of beds there, Ugu, we've got a plan that some of the patients can be moved to either eThekwini or they can be moved to Herikwala district. eThekwini, we can utilize Ilembe, or Ilembe can utilize King Cetshwayo, because these are provincial beds and we can move patients around as and when it's necessary to do so. So I am emphasizing a point that let's not allow people to make general statements, but where there is a problem, indicate that in this particular facility there is a problem and we will deal with it. But it's not a problem that is happening across the province. Now, with the issue of the PPEs, you know, I think it's is one or two media houses that are quite obsessed with KZN Albert Luthuli Hospital. Every time we meet, we talk about PPEs. It's not PPEs because it's PPEs generally, but it's PPEs because someone in Albert Luthuli said they don't have PPEs. And I think that's very unfortunate, because KZN Albert as a hospital and the workers that work there are not different from any other health worker, and they don't deserve any special treatment than any other health worker. All our health workers are important to the Department of Health, and all of them, we treat them with respect that is required, and we treat their lives as important as the rest of us. Having said that, we have enough PPE. I personally get reports on a daily basis on the amount of PPE that we have, how it's spread, the sizes that are available, and so forth. So I don't even mind. Should any of you require to get that particular breakdown of yesterday, for instance, where are the PPEs in each district? So we've got a report that talks about PPEs per district, but we also have a report that talks about PPEs per facility. The nature of the PPE that is available, the amount of PPE that is available, the sizes of the different PPEs that is available. So at this point, we don't have a problem of PPEs as a province. Yes, at the beginning of the infection around March, April, we did have a few challenges when our orders were not coming, but we have been able to go beyond that. Towards the end of July, there was an issue that was raised very harshly by the media in relation to Nkosi Albert and the PPEs. As a result, Premier, I also decided to go to the stocks in Nkosi Albert myself and actually go through the stock and see whether the PPE is available. And the PPE was there. So I think we again shouldn't be general. The issue of jumpsuits not being available is the issue. The jumpsuits that are being requested in Nkosi Albert are not part of the protocols that are given to health workers, and we have indicated this before. The protocols or the level of PPE that is given to a health worker is according to the treatment that is given by that. It's according to the level of treatment provided by that health worker wherever they are stationed. Jumpsuits are not part of the protocols of PPE given to us by national or the World Health Organization. Of course, there are organizations from time to time that will provide us or give us donations as the Department of Health. Some of those that give us donations will give us these jumpsuits, and if they give us the jumpsuits, we clearly accept them because they are donations. But the protocols and the PPE that is supposed to be given to health workers is given to health workers, including in Nkosi Albert Lutuli Hospital. Are we happy with the capacity of the beds in our province? I believe at this point we are doing okay. We don't have a problem. We are working on an incremental implementation of facilities. The Premier spoke about hotels and lodges that we were working at, and so far we spoke about 2 districts that have implemented that particular plan. We have decided as a Department of Health in KwaZulu-Natal not to go out and get contracts of hotels en masse, but we said we will sit down, look at our need, and as our need dictates, we then increase the facility, the bed utilization, or the utilization of the private lodges in that respect. It's important for us to do so because during the first wave, we decided all at once to go out and get contracts with all the lodges or with the lodges and the hotels in all the districts, only to find that in some of the districts we did not utilize the facilities that we had to full capacity. We used them, but we didn't use them to full capacity. So this time around we want to do it incrementally as and when there's a need. So as soon as we realize that there is a need tomorrow to get the beds, we've already had discussions with people who might be able to give us the service. As soon as the need arises, the following day a contract is activated. So we are quite happy in relation to that. Are we relying as government on the issue of banning of alcohol only? Well, you can't run away from the fact that it is assisting. The fact that we now don't have as many trauma, or currently we don't have as many trauma cases as we did when alcohol was open, it is a fact. Because the focus of your health workers as well is not just now on, it's not spread. They are able to focus on those that need their attention, not on trauma that was caused as a result of alcohol-induced state, whether we are talking about car accidents, stabbing, shootings, and so forth. So that's an issue we can't run away from. Of course, we can't just plan based on the fact that we are going to close or we are going to ban alcohol as the president had done. So we do have our plans, we do have a proper process that we are following, but the fact that president has banned alcohol has really assisted us. Having said that, I think it's about time that as a people, we start reassessing our relationship with alcohol. It's an opportunity that we need to, it's been given to us forcefully, granted, it's been given to us forcefully, but really we need to reassess our relationship with alcohol as a people. Is it proper that every year, as Premier was reading, EMS will know that an hour before 12 o'clock, calls will start coming in because people have been shooting each other, people are stabbing each other, car accidents, purely because of how we are abusing alcohol. Because that is the challenge that we are faced with as a society, the abuse of alcohol. I don't think anyone has a problem with alcohol generally, but it's abusing alcohol where we start having a problem. And I think as people, we need to start reassessing our relationship with it. And I think that is the only thing that's going to assist us moving forward. I think I've responded to all the questions.
Sorry, just before the Honourable MEC moves back to a seat, I'd like perhaps, Premier, with your kind permission, to just put a few more questions to the MEC, and then thereafter the Premier will return, and we'll have one question for the Premier, and the Premier can wrap up in isiZulu. So I think that, it's acceptable. So the first question that we've received from social media is, according to the projections of the department or government, provincial government, when are we likely to see the decline in infections? Then what are plans to involve, that's the second question, what are plans to involve the private sector in the fight against COVID-19? I think related to that also, I think one about collaboration and competition. Is the private sector currently referring patients to the public sector? So, the final one from Nianta Singh, it's how do we, as the public, access the quarantine or facilities and the field hospitals?
Sorry, repeat that?
That members of the public, how do they access the field hospitals or quarantine centers? I think that will be all, and then we will ask the Premier afterwards to wrap up. Thank you, MEC.
All right. No, thank you very much, Babungiti. When are we looking at the peak? I think that is the question. Our scientists are currently working on that, and they are, fortunately, we've got scientists both from the province of KwaZulu-Natal and national that are working on that, and as soon as we have the estimates, we will be able to provide the numbers for that. But from what we have been told by the scientists, we are not close to a peak as yet, or we have not peaked as yet, and it is a worry if we have not peaked when we are on, or we have gone beyond 5,000 in terms of our daily infections. So we've not received a proper scientific research as yet, and as soon as we get that, we'll be then able to indicate. Other plans to involve the private sector, yes, we are working with the private sector as the Department of Health. The head of department, together with those that are organized from the private sector, are working together in a sense that we are able to talk, and they refer. You asked, there was a question that was asked if the private sector is referring to the public sector. Initially, during the first wave, we signed a contract with the private sector to say, if we run out of beds as public, can we bring our patients to the private sector? And that was the contract we also decided to get into when we started with the second wave, only to find that in actual fact, it is now the private sector that is running out of beds and bringing their patients to the public sector. Certainly, we accept patients because those are all people of South Africa, and they need to be given the treatment as they need it. So we are currently taking patients from the private sector, but we do have a relationship with the private. I'm just talking private from an element of health. I'm not sure what the question was whether was it being general or it was just speaking to that. How does the public access the field hospitals? Field hospitals are accessed through the hospitals and the clinics. So should a patient or should a member of the public want to quarantine or need isolation and cannot self-isolate, we request that you go to your nearest hospital or your nearest clinic, indicate to the health workers there, and then they will be able to activate the proper protocols in relation to that. Thank you very much.
Thank you very much, Honourable MEC. So we'll ask the Premier to then referred to one question, Premier, which may have been answered already. It's about, it says, will people who refuse to comply with the COVID-19 regulations, will they be arrested?
No, thanks. We'll want to be clear on that question. Enforcement, it's here and it's going to be applied because we must all comply. And as I've said, non-compliant is going to be dealt with, whether you are selling alcohol illegally, whether you are refusing to wear masks, whether you are hosting events that are not allowed. We are going to deal with those. So we would want to be firm on that point. Having said that, in summary, siyafisa uqala sibonge ubukhona benu nonke abezindaba kule media briefing yokuqala yalonyaka ka2021. Sinifisela unyaka omuhle, sengathi kungaba unyaka onempilo, ukuthokoza nezifiso zenu ninonke zifulfilleke. Siyafisa ukugcizelela ukuthi singene kulonyaka singunyaka la singabantu base South Africa esikhathini la kunzima kakhulu, silahlekelwa izihlobo zethu nabathandiweyo bethu ngenxa ye-COVID-19.
All right, there you go. The Premier of KwaZulu-Natal there giving us the state of play in that